Starting with the global coronavirus pandemic, vaccine manufacturer Pfizer is meeting with federal health officials in the United States on Monday to discuss the need for a booster dose of the COVID vaccine as it prepares to seek authorization. The meeting coming days after the drug maker and its partner BioNTech announced plans to seek US and European regulatory approval for a third dose of their COVID-19 shot. There is increasing concern around the spread of variants, and data, they say, shows heightened risk of infection 6 months after an initial inoculation. Now, that has prompted a quick response from the U.S. Food and Drug Administration and the Centers for Disease Control and Prevention, saying Americans do not need a booster right now. Meanwhile, Israel says it's going to offer a third dose of Pfizer's vaccine to adults with weak immune systems, but it's still weighing whether to make the booster available to the general public. So for more insight and reaction, we now welcome from San Francisco, Dr. Monica Gandhi, an infectious diseases physician and professor of medicine at UC San Francisco. Thank you so much for your time on this day. So there are conflicting reports around the need for this booster shot amid suggestions there could be a waning immunity from the vaccine. Some experts say it's too soon to even have this debate and research should continue. Your thoughts?
Yes, so I agree with the latter. I wanted to explain that certainly the Israel data that was put out, that after 2 doses of the Pfizer vaccine was only 64% effective against symptomatic disease, that raised a lot of anxiety. Luckily, that was actually a very small data set, about 300 people. The UK and Canada since have put out very large data sets that 2 doses protect against symptomatic COVID, even with the Delta variant, at about 88% and 96% protection against hospitalization with the Delta variant. So to remember if we need a booster or not, we have to think about, and I'm sorry to explain it, but it'll take me a minute.
Please do.
Yeah, thank you. There are really 2 arms of the immune system, so we really have to explain this. They're what are called B cells and T cells. Okay, B cells are the ones that produce antibodies. The amazing thing about the vaccines is there was a paper just a couple of weeks ago in Nature that showed that what are called memory B cells are formed in response to the mRNA vaccines, including Pfizer. There was another paper from Oregon Health Sciences that showed that your antibodies will go down, but those memory B cells, if they see a variant in the future, they will come out and give you antibodies that are directed against that variant. Memory B cells can last 90 years. We've seen from people who have been studied from influenza who got it in 1918. And then there's been paper and paper after paper that shows you memory T cells are generated by the vaccines, and they're so in breadth and diverse. They work across the variant, even with the Delta. 10 mutations across the spike protein with the Delta cannot evade all of the T cells you form from the Pfizer vaccine.
So, Dr. Gandhi, what then do you make of Israel's decision to offer a third dose of Pfizer's vaccine to adults who have weak immune systems? Is that a necessary step, in your opinion?
Yes. I think people are immunosuppressed or people who are very elderly, even though we don't have the data on that yet, would be the ones that would benefit from a booster. We always give vaccines extra for immunosuppressed patients. This is a very common practice in infectious disease. They get higher doses of the influenza vaccine, or they will get repeated doses of a vaccine. That's common practice in those who are immunosuppressed. But for the majority of immunocompetent, to talk about boosters right now not only seems premature, but I actually think it's causing a lot more fear.
And when you hear that, for example, here in Israel, children from the ages of 12 upwards are getting inoculated, what do you make of the suggestion that perhaps children under the age of 12 might also get vaccines down the line? Your thoughts there?
You know, children are very, very low risk for severe illness from COVID, but children grow up, and it's fine to give children the vaccine only after we've tested the safety of the vaccine at different doses. I think it's important to remember that Pfizer, because of the risk of myocarditis, changed the doses of what they're studying in those under 12 to 3, 10, and 20 micrograms. Remember, adults and 12 to 15-year-olds get 30 micrograms. Pfizer did that because they realized we have to balance safety and effectiveness in young children. So we need those clinical trials to come out, prove that they're completely safe, and then children should be vaccinated.